to test or not to test, to treat or not to treat. Stay tuned for this week's episode on weighing alternatives when it comes to testing and treatment.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Well, this is Krista. Welcome back to MadeToBeWhole. This week we're going to talk about risk-benefit analysis and what tools we can use to assess risk-benefit, cost versus benefit when we're looking at our health. Now, obviously, you can start basic, the things we learned probably in middle school, junior high school, making a list of pros and cons, just like you're making an argument or getting in a debate, and that's a good basic starting point. But if you look, especially in the world of business, there are a lot of formal templates. So if you just search risk-benefit assessment template, you can find a lot of different tables, matrices, different things that you can fill out that help you when you're making decisions about your health, about what to do as far as testing, what to do as far as treatment. And you have to be really, really honest with yourself when you're looking at the risks versus benefits of all of your options. Sometimes people do this analysis, but they do it in a silo. They just do the analysis for one piece of the puzzle. So for one test or one treatment, but they're not analyzing it against alternatives. Because if you think about it, for every action, there's an alternative, something you could do differently, or the option of inaction, doing nothing. And there are risks and benefits of doing nothing or of delaying care. And if you're going to give yourself a really robust data set and make a better, more useful analyses, you can't just say, oh, I've looked at the risks versus benefits of antibiotics and I feel like slam dunk, all of the risks outweigh the benefits, I'm not going to do it. Or you could go to the other extreme and say, this is going to solve all my problems, no risk. I don't care what Krista says. I don't need a probiotic. This is fine. That both of those options are really, really not going to be beneficial. So you really have to look at everything. So in the context of vector-borne infections, which would be our Lyme, Bartonella, Babesia, those illnesses, you could look at prescription antimicrobials. So that would include your prescription antibiotics plus antiparasitics in the case of Babesia, because that's a parasitic intracellular infection. You could look at the risk versus benefits of using herbs for treatment. You could look at the risk versus benefits of SOT or other IV treatments. You could look at the risk versus benefits of a combined approach, which I think is the most balanced one. But then you also have to look at the risk versus benefits of inaction. And along with that, you've got to assess the impact of action versus alternative action versus inaction over time, not just what is the risk and benefit that I will experience now or in the next week or month, because right now inaction might be the most comfortable thing to do and seem like the least risky thing to do, but what will the state of your health potentially be in a year or 5 years or 10 years if you neglect this and choose not to act? Honestly, assessing that is going to help you make a better decision. You also have to assess the likelihood of each potential positive or negatives. So if you think about the example of surgery, for any of you who have had surgery, you always have to sign consents and these releases and disclaimers. And for every surgery, one of the possible adverse events is death. Now, obviously, the risk of death for some situations is much higher than others. So the risk of death for wisdom tooth surgery is pretty low. It depends on the actual procedure that's happening. It also depends on the age and the condition of the person having it. So I don't think it would be wise to say, well, if a possible risk is death, then this is never a good option because I don't want to die. No, death is pretty unlikely in most scenarios, but whether or not that surgical intervention, for example, is a good idea will depend on a lot of other factors. So what I like to do is use what I call the Isabel analysis, but I have expanded on it a bit. So the way my daughter deals with anxiety in an anxious situation, such as going into finals week, is she asks herself, what is the worst possible thing that could happen? And can I live with that? And if she can, then she just takes a deep breath and goes. And I mean, she's pretty brutal. Okay, worst possible situation. I fail this class, even though it's really not likely to happen based on her past performance. But if she can say to herself, the worst possible thing that happens is I fail this class and I have to take it again. Is that the end of the world? Could I live with that? Yes, I could. It would stink, but I could pay for retaking these credits and be okay. I think we have to add a little bit of nuance to that approach. So ask oneself, what is the worst possible thing that could happen? And then how likely is it to happen? What is the best possible thing to happen? How likely is it to happen? And you have to look at the glass as both empty and full, because people who are overly optimistic sometimes get sidelined by reality, because positive mental attitude sure helps us get through things, but it doesn't change that there will be things that are hard. But that doom and gloom, always looking for what's going wrong, that's not going to help either. So you have to say, what if it all goes right? Once you act, I think obviously you have to keep on your radar things you need to assess for, but don't focus on everything bad that could happen. If you've made that decision, focus on what you're working toward and tracking your progress. There's actually a song called What If It All Goes Right? What if it all turns out? What if good luck rains down? I don't remember all the lyrics, but I think it's a great concept. What if it all goes right? That can and does happen. It just takes time. The other thing that should be looked at when you're making this analysis are what are your resources. So resources include financial resources, time resources, logistical resources, support resources, and kind of evaluating your milieu. So what does your milieu look like from the point of your body and your physiology, from your environment, from your emotional state, and then assessing if these positive or negative things happen, what would you do? Do you have the resources to deal with that? So it's nuanced, but I think it's really, really helpful. So I wanted to use examples of a couple of things that we could apply this analysis to that come up fairly often. So some interventions and some tests are pretty low risk because, especially if cost is an issue, certain blood work, if you have, say, great insurance that pays for your labs and you don't have any difficulty getting your blood drawn, then it's not going, that's a very, very low risk intervention. You might get some positive or helpful information. If you don't, you're maybe not out a lot of money, little discomfort from having your blood drawn, no big deal. But other things are more expensive or more risky. So when I'm looking at interventions, whether they be tests or other diagnostic procedures or treatments, what I like to look at is, will the information or knowledge I gain from this change my interventions or my outcomes? So I have a lot of symptoms of what is called temporal arteritis or giant cell arteritis, and you get this really severe pain in your temporal lobe, which is like above your ear, and it's on the left side. It's pulsating, it's tender, it is absolute agony at times. I have figured out the pattern of it flaring with treatment, so I do believe it is all related to the infection treatment. But what would it benefit me to go get an actual diagnosis of giant cell arteritis or temporal arteritis. So when you go through the diagnostic procedure, there's basically two things that they do from a testing perspective. Blood work, because sometimes the sedimentation rate is elevated. That's an inflammatory marker. For me, it's not a big deal to test it, but I know that I use IV procaine regularly, and one of its purposes is that it brings down those inflammatory markers, so it wouldn't be particularly helpful. Then the other truly diagnostic thing they do is a biopsy of the temporal artery. So going and taking a little sample from one of your blood vessels and testing it. Well, that's an invasive intervention. There's time involved, there's money involved, but what's more important to me is what would change if I had that slam dunk diagnosis. If the biopsy came back positive and they said, yep, this is giant cell arteritis, that's what you're dealing with, that's really hard. Well, do you know what the treatment is, the standard of care? It's steroids. Steroids are great anti-inflammatories, but they also suppress your immune system. And in the context of somebody dealing with chronic infection, I don't think it's wise to overuse steroids. Sometimes they have a place and they can be life-saving. But in my situation, the benefit of that knowledge, other than a pat on the back to say, oh, you were right, Krista, that's definitely what it lines up with, would not change what I'm doing, because I'm not going to do steroid treatment. I'm going to continue other anti-inflammatory things, craniosacral therapy, and treating these bleepity bleep infections, because the intensity is starting to fade a little bit, and I feel like I'm headed in the right direction. Another example of something that you could assess would be whether or not to use contrast when you're having an MRI or a CT. So we have had some good information recently showing that not everybody can clear contrast, and that gadolinium, which is the contrast frequently used for MRIs, can cause toxicity in some people. I have seen that in labs, a young person who had an MRI with and without contrast because of neurological symptoms, and 6 months later, there were still really high levels of gadolinium when we did urine testing. So one could say, that's terrible. Why would you poison anyone with what you're trying to do to help them? We just should never use contrast. Never, ever, 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 ever. I don't think that is a good response to that threat. I think what we need to do is use contrast more sparingly. I think we need to look and say, okay, if there's something I really need to know that I'm not going to be able to get accurate results without contrast, and that information will help me do better and more appropriate treatment to have better outcomes, then you do it. They're getting better about using lower amounts. We can also do testing before and after. If you're not someone who's had a problem clearing toxins as much, it may not be as high of a risk, but it's just a nuanced personal decision. And I think that applying this pattern is going to be really, really effective in helping people make better decisions for their health. So let's go back and say, what would we do if you're looking at the risk and benefit of your options as far as some of the tests that we use and some of the treatments that we use? So I mentioned before how I like to look at testing, whether it be laboratory testing or other diagnostic things, to say, will the information that I get change what I do for this person or change the outcome? And I'm going to give a few examples of how that is possible, and not just possible, but really, really important. So, for example, if we are testing for Lyme disease, Bartonella, Babesia, or Ehrlichia anaplasma, any of these vector-borne infections, the tests that are really, really accurate are expensive. We've discussed this before, but they're costly, and for the most part, insurance is not very helpful. The one exception to that being if you have traditional Medicare without an Advantage plan. That's key. So you've got Medicare B, you might have a supplement, but you do not have a card that says anything advantage, Humana advantage, Cigna advantage, medical mutual advantage. That is only an advantage for the insurance company, not for you. So if you have traditional Medicare, you have your Part B, and you don't have an advantage plan, they actually are paying 100% for hygienics testing. But other than that, coverage is pretty spotty. You have to pay up front. Some insurance companies will reimburse, some won't. The reason, though, that I feel that test or similar testing like T-Lab I alternatively use, those are my two favorites, is because getting the right diagnosis will save you time and money. So example, when I first came into this world of treating vector-borne infections, I heard a lot of people talk about making a clinical diagnosis. So what a clinical diagnosis is, you look at the person's presentation, history, physical exam, and you say, based on X, I'm diagnosing you with X. So for me, I can say, well, Krista has clinically diagnosed herself with temporal arteritis because of the location and the quality of the pain and the intensity of the pain. That adds up, but she didn't do this big test. So we can't say slam dunk, but she's made a clinical diagnosis. So there are people who say, you don't have to have all of these expensive tests. You can just clinically diagnose Lyme disease. My warning on that, because I did a little more of that at the beginning because I was sensitive to people's wallets, was that I found it was costing people more money. And the reason is Lyme disease is a big, bad, awful thing, and it comes from a tick. But there are also other big, bad, awful things that can mimic or overlap with Lyme disease. The treatments that are effective for Lyme disease are not effective for those things. And so you can be spinning your wheels and spending money and just the emotional wear and tear and say, I've been treating Lyme for this long and I'm not getting better. It might be because we don't have the full diagnostic picture. Maybe you actually don't have Lyme disease. Maybe you have Bartonella, and the things that we commonly use for Lyme don't overlap a lot with Bartonella treatment. Or maybe this is a viral issue or a toxin issue, and you don't want to spend all of that expense and the wear and tear of your body of treating something with the wrong thing. And even within the infections that can come from a tick, say you got a tick bite and you got sick after that and you're like, no, just treat me for Lyme. I don't need these tests. I'm going to run through again some of the reasons that can be not effective or efficient. So Lyme disease, if we just look at the antibiotic world, you have doxycycline and other tetracyclines like minocycline. You've got amoxicillin, you've got your cephalosporins, you can use macrolide, which is azithromycin and clarithromycin. You can use rifampin, but most commonly people are treated with a combination of doxycycline and amoxicillin or a cephalosporin. And those are great medicines, and if you use them at the right dose for the right duration, you can use them to bring about some really good outcomes with Lyme disease. But besides the fact that Lyme disease is this stealth pathogen with biofilms that's kind of hard to get to, doxycycline and amoxicillin or ceftonir do very, very, very little for Bartonella. I always think of one patient I had who had slam dunk positive Lyme test and an indeterminate Bartonella test, and we treated him aggressively for the Lyme disease, even with IV antibiotics, and there was just very little progress. We added treatments that were much more effective at hitting Bartonella. That's when the die-off started. That's when the improvements started. That test was really, really important. And you think of the risk of not knowing that. Either you're going to keep treating with something that's inefficient, or you make the mistake that a lot of our medical world does that says, well, this really isn't Lyme disease then because you've been treated and you would be better. So you have post-treatment Lyme disease syndrome, you have fibromyalgia, you have something else, but there's nothing we can do. When in reality, it might not be Lyme disease, but that doesn't mean there's an infectious cause with an appropriate treatment. Another reason in this world that I find that to be super, super important is because of doxycycline. So doxycycline is first line line for Lyme borreliosis, especially acute Lyme disease. It is also really, really critical if somebody has anaplasma, Ehrlichia, rickettsia. All of those require doxycycline, or at least that's the preferred first-line treatment. So the reason I really want to know if somebody has those is because if they don't have Lyme disease and they have Bartonella, I'm not going to use doxycycline. It's just not, it's not that good for it. It's going to do very, very little. And I also am really cautious with doxycycline because particularly in the summer, I have a lot of patients who live and work outdoors, who are farmers. Doxycycline causes increased sun sensitivity. I warn my patients, but not all of them wear their hats and their sunscreen. And some of them, even when they do, will still burn. So in my population, because of demographics, I don't use doxycycline in the spring, summer months unless I have to. But if they have certain infections, I have to. And so I need to know that. The other thing, babesiosis, which we've talked about, you have to know if you have it because guess what? It's a parasitic infection. So all of the things you're doing for Lyme disease aren't going to have much effect. Some of the herbals will overlap, but the prescriptions won't. So that's just kind of an overview of why there's a risk to not doing good testing and how you could very, very quickly waste time, money, and health with inappropriate interventions. Now you look at the risks versus benefits of various treatments. So you have your prescription antimicrobials. Now I'm saying antimicrobial instead of antibiotic because antimicrobial is a broad umbrella term for anything that's anti or against microbes, which are these disease-causing organisms. Microbes can be fungi, bacteria, viruses, parasites. They all fall under that category. And some people will call everything that's a prescription an antibiotic. So they will say that atovaquone is their antibiotic. It's not an antibiotic. And I think that's important to recognize because antibiotics carry some unique risks that don't overlap with some of these other treatments. So we have to use the right language. But the risks versus the benefits of prescription antimicrobials. One of the things people talk about all the time is the gut and the risks on your gut of using antibiotics. And that certainly is a valid concern. You also have to look at, though, the people who have struggled the most with this. Some of them, it is because they haven't been using appropriate probiotics. That's certainly a big, big piece of it. Some of them haven't been willing to do the other extra things that you have to do. So it's not enough just to take your antibiotics. You still have to support your gut. You still have to do a lot of kind of extras for that. You also have to recognize that the risks to your gut of not treating Bartonella, Babesia, these other infections are actually pretty high. I have multiple patients who say all my GI problems went away after I started antibiotics. Doxycycline cured my diarrhea. I know that is not intuitive to a lot of people, but if you look at the fact that you have infections that are stealth, they can go anywhere in their body. Because Bartonella and Babesia are vascular and in the red blood cells, anywhere blood flows, you can have effects. So if you have the linings of your intestines that are inflamed and hot and on fire because of a chronic infection, you actually have some GI risks by not treating that. So you have to balance that out. Some other potential benefits of the prescription antimicrobials, if you're someone who has insurance, there's more likely to be coverage. Not all of them are covered and not all of them at the doses we use, but there's definitely that potential for some savings. I think that it feels a little more straightforward to some people, and we've got some really potent, good medications out there that can be life-changing. I mean, when I'm looking at the risks of treatment, I am always weighing them against the risks of not treating. And I feel like for many people, you can use prescription antimicrobials at least for a period of time and offset the risks with the other things you're doing. And also recognize there's going to be a period of rebuilding after you're done with treatment. Yes, there's going to be wear and tear because your body is in a battle and there's going to have to be rebuilding, but being able to walk again or not have chronic pain or have neurological or psychiatric symptoms resolve because we've got some medications that can actually cross the blood-brain barrier and effectively treat things there. That's pretty awesome. So another option for treatment that you can look at some of the risk versus benefits of are herbals only. So herbal medications have some outstanding benefits for treating infection and inflammation. If you are paying cash for everything, you don't have any prescription benefits. Sometimes herbs are a little less expensive. One of the things I like about herbs is because many of them are a liquid, you can titrate them up really, really slow. So sometimes we'll have people start with a drop of something and work up to a dropper full. For some people, the liquids are a downside though, because they don't like the cost. They don't like the bitterness of it. People like herbs because they feel that they are more gentle. I will say though, I think this largely depends on where you are in treatment and the condition you, the host, are in at the time that you start. Because I've had patients have severe disabling die-off with small doses of herbs because they are very, very potent. They're chemically complex, potent antimicrobials. So obviously they're going to have therapeutic effects too. Not everybody tolerates them well, and it's got to be individualized. I personally have not seen them be nearly as effective for neuropsychiatric symptoms just because of difficulty getting to the brain, although I have seen some benefits for that. I really think where it's at is the combined approach, where you look at what can we do with herbs, how can we pair that with appropriate prescriptions that are based on really, really good labs, and give someone the best recipe for success. How long you do one thing or the other, again, it just depends on the person's response. You know, if you stop a treatment and everything gets worse, you need to restart the treatment and figure out what else you can add to make this more effective so that we can be done and get off of it eventually. And you can talk to your provider about this, and you need to trust their experience when it comes to certain herbs or medications. So I'm guilty of it too. We all love the internet and we love to search. It's a great tool. But as we've said before, don't let what ChatGPT tells you trump the experience of someone who may have used or recommended or provided a medication, whether it's prescription or over-the-counter, herbal, or chemical, like multiple times. You've got to trust their experience in doing that. Remember, when you read about the side effect from a treatment, they are not making, most of the time, like dose-dependent declarations. You know, X intervention, like we said with the surgery, if you have surgery, you could die. Yeah, you could. And if you take X medication or X herb, this unpleasant side effect could happen, but it depends on who you are, how much you take it, how fast you ramp up your dose. And in the context of all of this, make sure you put in one column, what are the risks of doing nothing? Okay, you may be scared to start antibiotics or to start herbs or to do a test because you don't want to know if you have Lyme disease or autoimmune encephalitis. Or you don't want to know if there's been mold exposure because that would really, nobody likes to hear that there's mold. It's expensive and a pain to take care of and getting your house fixed and everything. But the risk of doing nothing may bring you a little short-term benefit or relief, or at least plausible deniability. But what makes me push through, particularly, I guess, with myself and my family, through some very unpleasant die-offs, some unpleasant phases of treatment, is because I take care of people who have had decades of untreated illness, and I don't like what I see. And they are not people who you can say carte blanche, oh, all of these people just weren't taking care of their health and that's why they got sick. Many of them were healthy and active and doing all the quote unquote right things when their immune system just couldn't handle what was being thrown at it anymore. For example, whenever my husband has started anything for babesiosis, he has a flare and vertigo. And vertigo was not a symptom that he had pre-treatment. And so you could say, oh my gosh, these are awful medicines. He was fine. And now whenever he starts something new, he's in the bathroom on the floor because his head's spinning for a week. Well, the fact that this happens with all of the anti-babesial treatments and not just a specific one confirms to me that this is die-off. And what I tell him and told him from the beginning, as much as this really stinks, this is telling me that if you don't treat this now, this is going to be a symptom that you're living with long-term. It's putting a highlight on Babesia, where it is in your body, and the havoc, not just that it is causing, but that it could cause. And keeping that in mind can help you through some rough times. And remember, most of us can only make a change or two at a time. So even though you may, in your risk-benefit analysis, say, I do not have emotionally or financially or logistically what I need to do big guns treatment right now, that doesn't mean that your other option is doing nothing. You can always do something. And my recommendation is that post-treatment, when everything's better, you don't abandon the somethings that have helped. Most people are going to need to keep on board some sort of herbal antimicrobial like allicin. Allicin is ALLICIN. It's the medicinally potent part of garlic. But there are a lot of benefits from taking that long term. And I've seen people who are so anxious just to put this chapter of infection in their past that even though we talk about continuing some of these maintenance things, they drop them all and then they're fine for a year or so and then things come back. That's not what we want. I want my patients to get better, but I want you to stay better. You will be able to get better. You are made to be whole, but your health isn't something you'll be able to take for granted in order to maintain that state long term. So thank you for your attention. Go online, look at risk assessment tools. I think there are some pretty good ones. And just the act of writing sometimes helps us make decisions. You absolutely, when people journal, they're able to process things in a way that they can't just verbally or internally in their own thought processes. And I feel that the same thing can happen as you go through and look at the impact of the different things you can do for your health and help you make a better plan for timing and implementation to increase your chances of success. So thank you for listening, and remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.